Welcome to our exploration of the evolving relationship between nutrition and public health. Over recent decades, the science of nutrition has advanced rapidly, influencing not only individual well-being but also shaping public policy and community health initiatives. As we dive into this topic, we'll examine how scientific discoveries, technological innovations, and societal changes are converging to redefine what nutrition means for our collective future. From the control of chronic diseases to the impact of economic and demographic shifts, nutrition stands at the forefront of public health progress. Let's begin by understanding the foundational challenges and opportunities that have brought us to this pivotal moment. Looking back, the major challenges in nutrition have remained surprisingly consistent over the decades. In the 1950s, experts identified key needs such as controlling obesity, understanding nutrition's role in chronic diseases, assessing nutritional status, and improving care for the elderly and those under stress. Despite significant scientific progress, these issues remain relevant today. This persistence highlights the difficulty of translating laboratory breakthroughs into widespread community benefits. As we move forward, it's crucial to remember that scientific knowledge alone isn't enough. Effective application and equitable access are essential for real public health impact. Several key factors shape the U.S. nutrition policy agenda. These include the national disease profile, scientific advancements, new technologies, demographic shifts, economic considerations, changing meal patterns, and the level of public and professional awareness. Each of these elements interacts to influence how nutrition is prioritized and addressed at the policy level. For example, as chronic diseases become more prevalent, nutrition's role in prevention and management gains importance. At the same time, technological and demographic changes create new opportunities and challenges for public health strategies. Public health agenda is closely tied to the nation's disease profile. In the United States, diet-related conditions such as heart disease, stroke, and cancer account for a significant portion of deaths. While progress has been made in understanding and controlling these diseases, nutrition remains a critical factor. Some conditions like undernutrition may not be as widespread but are important due to their impact on vulnerable populations. As new diseases emerge or existing ones evolve, the role of nutrition in prevention and management may shift, requiring ongoing attention and adaptation. Scientific discoveries continually reshape the role of nutrition in public policy. For instance, decades of research on blood lipids and cardiovascular disease have led to national education programs and new dietary guidelines. As molecular biology and genetics become more integrated into nutrition science, we can expect even more profound changes. Research priorities now include understanding nutrient needs across the lifespan, nutrient interactions, the link between nutrition and chronic disease, energy regulation, and effective nutrition education. Breakthroughs in any of these areas could significantly impact public health strategies. Technology is revolutionizing nutrition science and public health. Advances such as gene characterization, genetic engineering, food and ingredient synthesis, and improved food composition assays are expanding our capabilities. For example, mapping the human genome has enabled the identification of genetic disorders that affect nutrient metabolism, opening the door to targeted dietary therapies. The development of new food products, improved safety testing, and automated dietary assessment tools are also transforming how we approach nutrition at both the individual and population levels. Demographics play a major role in shaping nutrition policy. The U.S. population is aging rapidly, with a significant increase in the proportion of people over 85. This shift brings new nutrition concerns to the forefront, such as the unique dietary needs of older adults and the importance of preventing age-related diseases. As the population continues to age, public health strategies must adapt to address these changing needs, ensuring that older Americans receive the nutrition support necessary for healthy aging. Economics is a powerful driver of public health nutrition policy. The food sector represents a significant portion of the U.S. economy, with billions spent annually on groceries, eating out, and food industry operations. Economic considerations influence everything from food availability and affordability to the prioritization of nutrition programs. As food industry trends evolve and budgets shift, policymakers must balance economic realities with the goal of improving public health through better nutrition. Where and how people eat has changed dramatically in recent decades. Convenience is now a major factor, with more Americans eating out or purchasing prepared foods. The rise of fast food restaurants and prepackaged meals has altered nutrient intake profiles, often leading to higher fat and lower nutrient density in diets. These trends present both challenges and opportunities for public health, as interventions must now consider the realities of modern meal patterns and the environments where people make food choices. Studies show that meals consumed outside the home, especially in restaurants and fast food establishments, often have lower nutritional quality. For example, women who get more than 20% of their calories from such places tend to have diets higher in fat and lower in essential nutrients like iron, calcium, and vitamin C. These patterns are also seen in children and men. While the long-term health implications are still being studied, it's clear that public health efforts must address the nutritional challenges posed by modern eating habits. Public interest in nutrition has grown significantly. Surveys show increased awareness of the links between diet and diseases like heart disease and high blood pressure. Campaigns and media coverage have played a major role in educating the public, leading to greater understanding of the importance of sodium, fat, and cholesterol in health. This heightened awareness creates momentum for policy changes and encourages individuals to make healthier choices, reinforcing the impact of public health initiatives. Health professionals are increasingly recognizing the importance of nutrition in disease prevention and management. Data show that more physicians now believe in the benefits of lowering cholesterol and prescribing low-fat diets. However, the public often leads in adopting new nutrition knowledge, highlighting the need for ongoing professional education. Bridging the gap between public and professional awareness is essential for effective health promotion and the successful implementation of nutrition policy. Effective public health nutrition interventions begin with setting clear priorities. Issues like caloric balance, dietary fat, cholesterol, sodium, fiber, and calcium have emerged as top concerns. As our understanding deepens, goals and guidelines must be tailored to different groups and individuals. It's important to ensure that no single factor, whether economic, technological, or public demand, dominates the process. A balanced, evidence-based approach is key to crafting a national nutrition policy that serves everyone. Public education efforts in nutrition are becoming more innovative and far-reaching. Traditional methods like posters and pamphlets are now complemented by mass media campaigns, employer programs, and partnerships with the food industry. These diverse approaches help reach broader audiences and address the specific needs of subgroups such as the elderly, pregnant women, and minorities. As communication channels evolve, public health professionals must continue to find creative ways to promote healthy eating habits. Delivering direct nutrition services is a cornerstone of public health. Programs like school cafeterias, meal delivery for the elderly, and food vouchers for low-income families play a vital role in ensuring access to nutritious foods. The commercial sector, including supermarkets and restaurants, also has a growing responsibility to promote healthy choices. As public demand for better nutrition increases, collaboration between public and private sectors becomes essential for expanding the reach and impact of these services. Insurance reimbursement policies can significantly influence the availability of nutrition services. Currently, most nutrition interventions are not covered, except in specific cases like diabetes or cardiac rehabilitation. However, advances in technology and growing public demand may drive changes, making nutrition services a standard part of preventive care packages. Incentives for both providers and patients could help integrate nutrition more fully into the healthcare system, supporting better health outcomes for all. Tax policies are another tool for influencing nutrition-related behaviors. While the U.S. has primarily used tax incentives to encourage workplace nutrition programs, other countries have experimented with taxes on unhealthy foods to promote better choices. Taxation can also support industry efforts to improve food safety and employee health. As policymakers seek new ways to encourage healthy eating, tax strategies may become a more prominent part of the nutrition policy toolkit. Regulation plays a critical role in protecting public health, especially as new food products and technologies emerge. Issues such as food labeling, safety testing, and health claims are increasingly complex and require careful oversight. Regulatory agencies must balance innovation with consumer protection, ensuring that new products are safe and that information provided to the public is accurate and helpful. As the food landscape evolves, regulation will remain a key component of nutrition policy. Effective nutrition interventions require collaboration across multiple sectors. Federal efforts alone are not sufficient. State and local governments, businesses, educational institutions, and media organizations all play important roles. Strengthening these partnerships ensures that nutrition initiatives are tailored to local needs and that individuals have the support they need to make healthy choices. Building multisectoral capacity is essential for achieving lasting improvements in public health. As nutrition science advances, ongoing training for health professionals becomes increasingly important. New technologies, research findings, and intervention strategies require updated skills and knowledge. By investing in professional development, we ensure that healthcare providers are equipped to deliver effective nutrition guidance and support. This, in turn, strengthens the overall impact of public health initiatives and helps bridge the gap between scientific discovery and practical application. Research and monitoring are fundamental to advancing nutrition and public health. Ongoing studies help identify emerging trends, evaluate interventions, and refine strategies for maximum impact. Surveillance systems track population health and nutritional status, providing the data needed to guide policy decisions. By maintaining a strong research infrastructure, we can respond effectively to new challenges and ensure that public health efforts remain evidence-based and responsive to changing needs. Looking ahead, the future of nutrition science is moving toward greater individualization. Instead of broad recommendations, advances in genetics and technology may allow us to tailor nutrient requirements and interventions to each person's unique needs. This shift could lead to more effective prevention and management of chronic diseases, as well as improved overall health outcomes. As we embrace these possibilities, it's important to ensure that personalized nutrition remains accessible and equitable for all. Future research will focus not just on understanding nutrient interactions and bioavailability, but on using this knowledge to influence disease outcomes. By titrating nutrient intake and optimizing absorption, we may be able to prevent or manage chronic diseases more effectively. This approach represents a shift from one-size-fits-all recommendations to more nuanced, targeted interventions that consider individual differences in metabolism and health status. As our understanding of nutrition and chronic disease deepens, we're moving toward a matrix management approach. This means using a combination of dietary tools and strategies to address multiple aspects of disease prevention and control. Rather than focusing on single nutrients or interventions, this approach recognizes the complexity of human health and the need for integrated multidimensional solutions. Such strategies hold promise for more effective public health outcomes. Interplay between genetics and behavior is becoming increasingly important in nutrition science. Understanding how inherited traits and lifestyle choices interact to influence disease risk will enable more precise and effective interventions. This knowledge can help identify individuals at higher risk and guide personalized prevention strategies, ultimately improving health outcomes across the population. Technological advances are making it possible to analyze dietary patterns and health risks with unprecedented precision. Automated tools can assess individual predispositions and preferences, providing dynamic feedback and tailored recommendations. This shift from general advice to sophisticated data-driven guidance has the potential to revolutionize nutrition education and empower people to make healthier choices based on their unique needs. In the future, health targets may become more precise and individualized. Instead of broad goals like lowering average cholesterol, we may focus on specific nutrient-to-cell ratios or metabolic set points. Advances in biotechnology could even allow us to monitor neural peptides or other biomarkers in real time, enabling more targeted and effective interventions. These innovations promise to make nutrition a more powerful tool in disease prevention and health promotion. Genetic engineering is poised to transform agriculture, enabling the development of crops and livestock with enhanced nutritional profiles and disease resistance. These advances could improve food security, reduce the prevalence of diet-related diseases, and support more sustainable food systems. As with all technological innovations, it's important to balance potential benefits with careful oversight to ensure safety and equity. Despite scientific advances, significant challenges remain. Disparities in health outcomes persist, with higher rates of heart disease and infant mortality among certain populations. The biggest gap may not be in knowledge, but in the equitable application of what we already know. Ensuring that all members of society benefit from nutrition science requires action, not just further study. Addressing these challenges is essential for achieving true public health progress. As we look to the future, the path forward in nutrition and public health is both challenging and full of promise. Scientific discoveries, technological innovations, and societal changes are converging to create new opportunities for improving health at every level. The key will be to act decisively, ensuring that advances are applied equitably and effectively. By working together across sectors, disciplines, and communities, we can harness the full potential of nutrition science to build a healthier future for all.